Generalized anxiety disorder, sometimes known as GAD, is one of the most common mental health disorders today. Maybe you've been dealing with anxiety symptoms for a long time, or maybe it came about as a result of societal split or other environmental circumstances in your life. Most of the time, your experience is imperceptible to others, but it is extremely disturbing within. You may be hesitant to tell your family or friends about your everyday struggles for fear of being criticized, or you may believe that ignoring your anxiety will make it go away. So, hello, and welcome to our today's video, in which I will be your host to take you through the 10 most common signs and symptoms of anxiety. If you do have any of the signs or symptoms we list in our video, we would recommend seeing your psychiatrist if you are concerned about them. Please take a second by clicking the bell icon to subscribe to our channel so you don't miss videos like this in the future, which are helpful to you and others. Anxiety and panic disorders cause a wide range of uncomfortable physical symptoms. Most of the time, people are unaware that their symptoms are caused by anxiety, which adds to the problem because many people believe that their symptoms are caused by an underlying ailment, which leads to even more anxiety. This vicious spiral can be interpreted by learning about anxiety and recognizing the bodily symptoms. Here are the 10 most common symptoms of anxiety. Number 1. Fatigue. GAD is a very common symptom of feeling fatigueness easily. People are often surprised to hear the fact that fatigue can be a cause, as anxiety is commonly associated with arousal or hyperactivity. For few people, anxiety is followed by fatigue, while others almost all the time may feel fatigue. It's unclear if this exhaustion is related to the hormonal effects of GAD or is caused by other frequent anxiety symptoms like insomnia or muscle strain. Chronic anxiety causes the body and mind to be tense and alert all the time. Emotional stress and physical tension result from the mind's continual scanning of the external and internal environment for threats. This persistent level of awareness causes mental and physical tiredness, which might last even after a good night's sleep. Apart from anxiety, fatigue can be caused from minor problems too, like depressed or irregular eating, including other medical issues. So it's not correct to identify an anxiety problem based on fatigue alone. Number 2, muscle aches and weakness. Tension as well as overall poor health can induce muscle aches and joint discomfort. Anxiety causes muscles to stiffen up, causing discomfort and stiffness in nearly every part of the body. Constant anxiety and stress can also cause the immune system to malfunction, resulting in a lower resistance to infection and illness. Another common sign of anxiety is having stiff muscles on most days of the week. While stiff muscles are frequent, the link to anxiety is uncertain. Muscle weakness, which is most typically noticed in the legs and arms, is another common sign of GAD. The body prepares to take action against threats during the fight or flight reaction. One method the body prepares for this action is to divert blood flow to the parts that are most needed, such as the legs, which are required for running away from danger. Increased blood flow to the legs might make them feel sluggish, tingling, or jelly-like. Number 3, trouble falling or staying asleep. It is another sign because sleep necessitates tranquility. Being anxious prevents you from being comfortable and serene. Depression and anxiety can either cause or exacerbate sleeping problems. Having an anxiety attack adds fuel to the fire. Insomnia is a medical term for people that struggle falling asleep, staying asleep, waking up too early in the morning, or waking up feeling tired. Anxiety will keep you awake many times during the night. It will give you recurring and persistent thoughts that may or may not be true. Anxiety is caused by a chemical imbalance in the brain and a disruption in the thought process. When you are stressed, your body almost instinctively turns to anxiety issues. According to some research, persons with insomnia are 10 to 17 times more likely to develop other mental health issues, including anxiety. While there's a substantial correlation between sleeplessness and anxiety, it is still unknown and not less than a mystery that whether insomnia causes anxiety, vice versa, or both. What is known is that when a person's underlying anxiety issue is treated, insomnia frequently improves as well. Suffering over falling asleep can worsen the condition by provoking sleep anxiety, which enhances to a person's feeling of foreboding and fascination. Anxious thinking about going to bed, a type of chronic stress, can significantly impair a healthy sleep routine and reflex. Number 4, heart palpitations. Heart palpitations are one of the most uncomfortable anxiety symptoms since they may be frightening and make individuals think they're having a heart attack, especially when they're accompanied by chest pains. Anxiety-induced heart palpitations normally subside within a few minutes. They usually begin suddenly and cease quickly. If you suffer recurrent heart palpitations as a result of anxiety, your doctor may diagnose you with an anxiety disorder. Excessive anxiety impairs your daily activities, such as going to work or school or seeing friends, if you have an anxiety condition. It's possible that heart palpitations aren't connected to stress if they don't go away in a few minutes or occur frequently. Heart palpitations are more usually usually caused by a medical ailment or disorder. Heart palpitations can cause the following symptoms: fluttering, irregular heartbeat, or pounding. Number 5. Dizziness. Dizziness encompasses a variety of feelings that produce unsteadiness related to the illusion of movement, such as lightheadedness or vertigo. Dizziness can be caused by a variety of underlying conditions, including vestibular, neurological, or psychological disorders. Anxiety is a normal stress reaction that activates the sympathetic nervous system, allowing the body to prepare to fight, flee, or freeze. Anxiety can be acute, such as before a date, or persistent, such as when you have an anxiety condition. People with more severe dizziness, on the other hand, have higher levels of anxiety and impairment, as well as poor quality of life. Anxiety and dizziness have a complicated connection. Some people become dizzy as a result of their anxiety, while others become dizzy and then become anxious about it. A 2012 study discovered a substantial link between dizziness, anxiety, and depression. Number 6. Shortness of breath. It is one of the major signs of anxiety. Shortness of breath is another troubling sensation that prompts many individuals to believe that they're having a heart attack, choking, or having lung problems. Breathing too rapidly, hyperventilation, causes shortness of breath because the body is inhaling too much oxygen and releasing too much carbon dioxide. You will not be harmed by hyperventilation, but you may feel as if you are choking, have a lump in your throat, or unable to take in enough oxygen. Anxiety can cause shortness in breath and other physical symptoms. One of these reactions is shortness of breath. It can feel as if you are hungry for air and not being able to get enough. This is due to hyperventilating or breathing too quickly. When we are anxious, we begin to breathe more quickly. This is part of the fight or flight response, which prepares our bodies for action when confronted with danger. In order to provide extra oxygen that our muscles necessitate for urgent action, we inhale faster to start taking in more air. In a genuinely risky position, we require extra oxygen to keep our muscles provided as we use it up quickly. If you're feeling shortness of breath as a result of an anxiety attack, it may seem paradoxical to focus on your breathing. However, by concentrating on your breathing, you can bring it under control and ensure that the proper quantity of oxygen enters your lungs. Diaphragmatic breathing, according to experts, should be practiced. Number 7. Headaches. Anxiety symptoms include sharp pain, a dull aching, or a sense of pressure around the head and eyes. Because stress can disrupt the body's hormonal balance, some women experience an increase in migraines, which can be induced by hormonal fluctuations. Is it anxiety that causes headaches or vice versa? The answer is not that straightforward. Headaches are a typical sign of anxiety disorders such as GAD. That is a state in which you are continually worried and find it difficult to regulate your anxiety. Headaches are one of the symptoms that doctors look for when diagnosing GAD. Some people have a history of migraines before developing GAD or other anxiety disorders. Others get anxiety first and then migraines. Anxiety and depression are more common in migraine patients. When you have all three, it generally starts with anxiety, then migraines, and finally depression. Number 8. Digestive discomfort. The stomach is the second brain and is the leading indicator of emotion. These findings show that people's emotions and gastrointestinal health are inextricably linked. Anxiety is a form of strain, and the stomach is the most sensory organ of pressure, so it will have an effect. People who are nervous tend to swallow a lot of air, exacerbating flatulence and gastrointestinal discomfort as a result of their rapid breathing. If the stomach shrinks or bloats, the diaphragm is stimulated, resulting in heart discomfort and paleness. Anxiety disorder of the intestines. Long-term nervousness results in gastrointestinal dysfunction, loss of appetite, eating less, indigestion, upper abdominal fullness, and flatulence. Severe cases may also experience nausea and vomiting, as well as a dense knot in their stool and diarrhea. Stress can produce excessive gas, bloating, stomach cramps, acid reflux, heartburn, constipation, and diarrhea. Several digestive disorders, including irritable bowel syndrome, IBS, have been related to long-term stress and mental health issues. Some people's symptoms of food intolerance and sensitivities might be exacerbated by anxiety. Numerous studies have found a link between anxiety, depression, and functional GI symptoms. Number 9. Avoiding social situations and excessive worrying. If you see yourself doing any of the following, you may be suffering from social anxiety disorder. Anxiety disorders actually worsen the established social and communication problems that people with this mental state have issues in communicating their thoughts to others. It also means that anxiety can make you lose confidence in yourself and can make you have problems while making common and normal communication with people. It makes it difficult to communicate to familiar people, and talking to strangers becomes as close to impossible at a certain stage. You will be diagnosed by a doctor with GAD if your concern lasts at least 6 months and is difficult to manage. Women are nearly twice as likely as males to develop GAD, and the disorder frequently coexists with serious depression. Number 10. Panic attacks and irrational fears. Anxiety is the root cause of panic attacks, which can be described as short time of intense worry that results in physical terror. Symptoms include a rapid heartbeat, breathlessness, dizziness, quivering, and fatigue. Panic attacks occur on a regular and unpredictable basis, and they are usually unconnected to any imminent force. A panic attack is characterized by an intense wave of fear that is unexpected and debilitating, immobilizing in its intensity. Complications and prevention of anxiety. Anxiety disorders do more than just make you worry. It can also cause or exacerbate other mental and physical problems, such as depression, misuse of drugs, bad quality of life, social isolation, suicide. That is why prevention of anxiety is a must. That's the end of the video. We hope you're doing well. Let us know in the comments below if you have anything to add. Thanks for watching.